Okay, thank you very much, Ian Seath. It's lovely to be here this evening. So we're going to talk about disc extrusion, and we're going to focus largely on the decision-making aspects of this condition because these can be really challenging, and talking these through with dog owners. So just firstly, let's have a recap of how these dogs present. You may find that dogs come in initially with some early warning signs. Not always. Sometimes they just come in with full-blown disc extrusion and severe signs, but they may come in initially just looking not quite right in themselves. A very typical sign, especially in Dachshunds, is crying or yelping on being lifted. And in other cases, they may be just reluctant to move, particularly to go over a step, or reluctant to jump up, or reluctant to shake. Some of them, but not all of them, look hunched, like these two examples here. So that's a very typical sign of disc extrusion. And in some cases, they may have a surprisingly tight, swollen abdomen, almost like a boarded abdomen. And this can look very confusing. They may look like a dog with a gastrointestinal upset, or perhaps with acute pancreatitis, just really off colour, generally painful, not right in themselves. This can be confusing. But always take these early warning signs seriously. Even if the dog looks quite normal on coming into you, if the owner says, my dog has been crying or yelping on being lifted, take that seriously. These dogs could get worse. And then let's look at the more typical signs of a disc extrusion. So most of these dogs do present painful when they first come in, and the pain may look like this on the left. Some dogs have bouts of pain in which they shiver or shake. So that's very typical. And it can come and go. That little dachshund shivering. And those dogs, they may also have more severe neurological signs, or they may go on to have a lot of difficulty walking. So we've got a dog here with paraparesis. This dog had a thoracolumbar disc extrusion, and he's got weak hind legs. They're crossing. He's got poor proprioception, poor position sense, sometimes even not knuckling the paws there, affecting both hind legs, which is quite typical in this condition when it affects the back. But quite often one hind leg is affected more than the other. That's also common. And these dogs often stand or walk with their paws upside down, knuckled like this. And of course, very severely affected dogs may be unable to walk at all. So like the dog on the right, this one is paraplegic with no voluntary movement in either hind leg or in the tail. Now, it's very helpful to give these dogs a clinical grade to get an idea of how badly they're affected. This is really useful in practice because it allows you to track how they're doing, and it also gives some idea of their prognosis. So there are various grading systems out there. The one that's often used is this 5-point scale. It goes from 1 as the mildest affected dog to 5 as the most severely affected dog. And all of these are painful, usually. Nearly every case is painful, at least for the first few days. There are exceptions, and this is the case for every grade of disc extrusion. But for grade 1, they're just painful, and they just continue to be like that until they get better. Or, of course, they may actually deteriorate and go up a grade, unfortunately, or even progress right through the grades. So grade 1 dogs are just painful, and that may be just generalized pain, as we've seen in those warning signs. It may be pain really localized to the area of spine that's affected. Grade 2 dogs, as well as being painful, they are ataxic and weak on their affected legs. just like the white dachshund whose video I just showed you. For grade 3 to 5 dogs, these dogs cannot walk, non-ambulatory. So grade 3 dogs, the mildest affected of those that cannot walk, they still have voluntary movement in their affected legs. So they actually can't walk without support, but they can step a bit if you do support them. Grade 4 dogs, they are paralysed in their affected legs. They can't. So if you support these dogs, they cannot make any attempt to walk at all. And grade 5 dogs, not only are they paralysed, but they've also lost their deep pain sensation. So they are very severely affected. And you can test for that deep pain sensation, of course, in practice. So to test for pain sensation, you just pinch across the bone of a toe, of one of their toes of an affected leg, and a dog with pain sensation will show a conscious response to that. They might turn their head, they might growl or try and bite you, or if they're very stoical, they might not really do very much, but perhaps you may see that they may suddenly pant a lot, or their pupils might dilate with the pain. So these are all conscious signs of pain. And if the dog does that on having a toe pinched, they do have pain sensation. If the dog doesn't do any of those, then you could repeat the test, this time with forceps. And if they don't respond to that, then they don't have deep pain sensation. That's a sign of very severe disease. Unfortunately, it can get even worse than that. So the worst case scenario is progressive myelomalacia. Dogs at risk of that are those that don't have deep pain sensation. And if it's going to happen, it'll happen within the first 2 weeks. It can happen even if the dog has surgery, but also if they don't have surgery. And what happens with this progressive myelomalacia is that the dog unfortunately goes downhill, they become increasingly painful, and they progressively lose reflexes cranially in the body. Eventually they're unable to breathe, and this really isn't compatible with life long term. Unfortunately, there's no treatment available, so euthanasia would be recommended if this is happening. Now let's look at the prognosis for dogs with disc extrusion. Now, this chart comes from the ACVIM consensus statement on disc extrusion, which has just become available online, I'm delighted to say. So this has been, of course, it's come over from the US. It's packed with information, so this is a very interesting document. And so what we're seeing here, we've got a column for prognosis after spinal surgery, that's after decompressive surgery. And we've got the prognosis for these dogs who have not had surgery. And then a bit like our grade chart, we've got different severities of clinical disc extrusion on admission. So in the bottom row, we've got dogs who came in with no deep pain. Here we've got dogs that were paralysed but still had deep pain. This row here is like our grade 3 dogs. They can't walk, but they do have voluntary movement, and they do have deep pain sensation. And this row here is the dogs that can walk. So that's like my grade 1 and 2 dogs kind of lumped in together into that top row. And the first thing I would say is that as we go down the table, unfortunately, the prognosis gets worse. And particularly for these deep pain negative dogs, they have a worse outlook than other dogs, whatever we do. But something has actually changed, because we used to be told that these deep pain negative dogs had to have surgery, otherwise they really weren't expected to recover at all. They had pretty much no chance. And now we know that some dogs, not a great percentage, but some dogs actually do recover even without surgery. Another thing to point out with this table is that in general, dogs that have surgery do somewhat better than those that don't. They tend to have a better chance of walking again, at least according to the statistics that we have. But we need to be aware, actually, if you look at the papers that were collated to come up with these figures, so that if you look at the original studies, some of the dogs from these groups that were operated on, they actually deteriorated during surgery. And those were the failures. There weren't many of them, but a few of the failures had actually deteriorated badly. And this is one of the challenges that spinal surgery, it is obviously a very invasive procedure. And when complications occur, they can be devastating. So it's not quite as simple as, just plumping for surgery necessarily. We have to think of all the pros and cons. Just go on a slide. Yeah, we've got more data on the way as well. So I'm pleased to say there's another study underway based at Cambridge University, and this is coming up with some very interesting information so far. So they're looking at dogs being managed without surgery. They've all gone into the study unable to walk, and then they're managed medically. And these dogs will be in these 3 cells here. So they're going to be managed without surgery, and they include the deep pain negative dogs. And so far, they've had some very, very good success. So that at the ECVN Congress last month, they presented the abstract and reported that they had 79% of their dogs walking again so far. That's out of 47 cases, and this included quite a few deep pain negative dogs. So some success. They're just continuing the study, and it will be fascinating to see the results when these are published. The terminology for back disease is not very user-friendly, of course. So we're dealing with disc extrusion, of course, Hansen type 1 herniation, and certain breeds prone to that, the Dachshund, the French Bulldog, certain other breeds, miniature poodles and some other smaller breeds and those with shorter legs. These are the chondrodystrophic breeds. And what's happening here is that their discs degenerate early in life. And here we have a photo. Actually, this is one of the specimens of Hansen back in the 1950s. So this was a Dachshund disc. This had an extrusion. And here we can see how the outer part of the disc, the annulus fibrosus, had ruptured, and the inner part of the disc, the nucleus pulposus, has pushed through the gap, extruded. And this material coming out dorsally will compress the spinal cord, and can also, if it comes out with some force, it can bruise the spinal cord or even cause hemorrhage and quite severe damage. So that's a disc extrusion. And when we're talking to dog owners, most of them have not heard of a disc extrusion. You may find some of them do know the term IVDD, intervertebral disc disease. Sometimes IVDD is used by enthusiastic dog owners and breeders and others. In fact, they use it really to refer to a disc extrusion, and they sort of use the 2 terms interchangeably sometimes. So IVDD is sometimes a helpful term to drop into the conversation. Although really, IVDD correctly is an umbrella term. It refers to disc extrusion, disc protrusion, and disc degeneration. Any of these, they will come under that heading. Sometimes if owners are looking at me blankly when I say your dog appears to have a back or neck problem, maybe it's a damaged disc, perhaps IVDD, and they're still looking at me blankly. And sometimes I say, well, this is a bit like a slipped disc in people. But I've crossed that out here because if you do say it's a slip disc, do point out the disc hasn't actually slipped out of position. Instead, think of it as a ruptured disc, because we don't really want people going away and thinking that the disc can sort of be pushed back into position. That's not how it works. That's a bit misleading. So how are we going to diagnose this? The most sensitive test for diagnosis of disc extrusion would be MRI or perhaps CT. These are both very expensive. So MRI in this country, a common cost is something like £2,000 once the sort of admission to the referral clinic and the necessary anaesthetic cost is taken into account. These are, of course, always, they are certainly done before spinal surgery, but they're actually not needed for every case, not for those that are not going for surgery. So MRI or CT is your definitive diagnosis, but in a Dachshund or a French Bulldog, in a dog that's really prone to this condition, it's perfectly sensible to make a presumptive diagnosis based on their typical history and clinical signs. And in these dogs, you'd expect that their clinical signs to come on quite suddenly, quite acutely, or perhaps over a few days. You might see those warning signs I talked about first. You wouldn't expect the problem to be gradually getting worse and worse over a whole year, like degenerative myelopathy, for example. And the clinical signs, we've already discussed some of these. We're talking mainly about back disease today, thoracolumbar disc extrusions. And with these, you'll tend to find that the dog's front legs are unaffected. The hind legs are the ones that have lost reflexes and are very weak and incoordinated. If you're unsure, sometimes supporting the dog carefully in a standing position can help you work out which legs are affected or are not affected. And it can be helpful to do this proprioceptive paw placing test. So what's happening here is the dog is being, the clinician is supporting the dog under their abdomen with one hand, and with the other hand they have turned the paw upside down. In a normal dog, of course, the normal dog would turn their paw the right way up, certainly within 2 seconds. They'll often do it within 1 second. If the dog has reduced paw proprioception, they will be slow to turn their paw the correct way up. If the proprioception is absent, then they will not attempt to turn their paw the right way up. They'll just stand with it upside down like this. That's a very helpful test. So we need to get a good history. Do get a general history. Ask your general questions. It helps to rule out other conditions. Regarding the presenting signs, check when they started. Ask about whether they're getting better or worse. It just gives you a kind of a pattern for what's happening. And find out more. Ask people, when did your dog last pee? They might not know, but if they do, it's helpful. Many of these dogs have difficulty urinating. Was there a fall? It's quite common to hear that a dog with a disc extrusion has had a little incident, like landing awkwardly after coming off the bed, for example. That's quite common. But if in fact the dog has had a road accident or they've fallen from an upstairs window, then you may need to think about something else going on, perhaps a spinal fracture, for example, or other trauma. And ask the owner whether there have been any previous episodes or something similar that they're aware of, because often this can be a recurrent condition. Their examination. Do some general physical examination. That's really important because you're trying to rule out other things. Generally, there won't be any other clinical signs. But for example, if you notice a lot of unexplained weight loss, or lymphadenopathy, or say, for example, their mucous membranes with petechiae on them, you wouldn't expect any of those clinical signs. They don't fit in with the pattern of with the picture of disc extrusion, and they would send you down a different diagnostic path. So you've got your general physical examination, and then the neurological examination. I feel this has changed a bit. In days gone past, we used to be told do every neurological test. That's helpful. Now, I really recommend just stick to a few brief tests. The full neurological examination, it's very long. It takes up too much of the consultation time. The detailed tests are not necessary, and many of them can be misleading or unreliable, and they can be quite upsetting to the dog. So what I recommend you do is start hands off. You can get some excellent information just by looking at the dog. Are they alert and aware and interactive? What's their posture like? So like this dog here, normal upright posture. You would not expect a dog with a disc extrusion to have a head tilt, so check for that. They shouldn't have any, their face should be symmetrical, so if there's any facial asymmetry, that does not tie in with disc extrusion. And establish whether they can walk, and if they are walking but they're not walking normally, can you see which legs are affected? Is it all four legs, or just the hind legs, or just one leg? That's all really helpful information. And can they stand? And sometimes these dogs are sort of reluctant to do anything. So in this bottom picture, this dog is just being supported. What you may need to do is this: support the dog carefully in a standing position, and then sort of gradually reduce your support and see if they can hold the position. And this dog will be distracted from in front by a colleague or by the dog's owner, who you can position in front. I've already mentioned the paw placing test, where you support them like this and turn the paw upside down. That's really essential to include. And I would also pain test methodically down their spine, but I would start by doing that quite gently. These dogs are already having a bad day, and the aim of this is not to make the dog scream, but instead just to really try and locate where they're tender in a humane manner. Start quite gently, look for subtle signs of discomfort, the dog just flinching or licking their lips or yawning. That's all really meaningful. That's their body language to tell you they're painful. If you get no response, you can repeat it with moderate pressure. But look, don't press too firmly. Even if the dog is not actually responding to that, it doesn't rule out a diagnosis of disc extrusion. So, should we do more tests? Spinal radiography. So the feeling about this has actually changed over the past couple of decades. We used to routinely x-ray these dogs, and if you do x-ray them, some dogs with a disc extrusion, you'll find they have a narrowed disc space, which is very likely to indicate the disc extrusion. However, this isn't that helpful. If you do find a narrow disc space, and if you send that dog off for surgery, the surgeon cannot operate based on your x-ray findings. They're still going to need to do an MRI or CT. So this all becomes very expensive. And in addition to that, unfortunately, radiography is not very sensitive at identifying this. So they miss X-ray, even really good quality X-rays will miss 30 to 40% of disc extrusions. Remember, to identify them, you need to see a narrow disc space. It's no good just looking for calcification in the discs, because you may see that in otherwise healthy dachshunds, even if that's not associated with clinical signs. So this has poor sensitivity, and it's unreliable at spotting the main differential diagnoses. So for example, so two of the main differential diagnoses are traumatic disc and fibrocartilaginous embolism. Both of these can affect any breed. They often happen very acutely, particularly might be after a bout of fast exercise. That's typical. They can happen to Dachshunds and French Bulldogs too. Um, they're not seen at all on radiography. Another differential is meningoencephalitis of unknown origin, an inflammatory condition that won't be seen on radiography. And radiography is not great at picking up spinal tumours. It doesn't always pick up discospondylitis. There's often a delay in signs appearing. And if you're trying to tell apart acute pancreatitis and disc extrusion, which is a common scenario, again, radiography is not very helpful because it doesn't reliably pick up pancreatitis. What about running blood tests? It would be great if they helped us, but unfortunately they don't give us the diagnosis. There is no blood test for disc extrusion, of course, and it can be worthwhile telling owners this so they understand, so that we're all on the same lines. Even if we're trying to differentiate pancreatitis and disc extrusion, usually the bloods are quite unhelpful. The CPLI can be raised in both conditions. Now, you may want to consider bloods and urinalysis if the dog is systemically unwell. Perhaps they're clearly dehydrated, and you just need to get some idea of what's going on. Also, you may consider getting baseline values before starting your analgesics in some cases. But this is not actually to get the diagnosis of disc extrusion, of course. So what should we do next? Shall we refer? So our main options are spinal surgery. That'll be decompressive surgery for a thoracolumbar disc extrusion. It would usually be hemilaminectomy, or medical treatment. Bear in mind, before we start thinking about this, let's bear in mind not every dog gets better whatever we do. So bear that in mind, and also sort of keep at the back of your mind, some of these dogs, even if they don't get better, for some of these dogs there is a way forward to have a life in wheels. It's not a solution for every dog, but it can be successful, particularly for dogs with quite short legs and a low centre of gravity. So that's just something to sort of keep at the back of your mind, maybe as a possible backup plan, and maybe even to mention to the owner early on in the course of the condition, just so everyone knows that's available. So surgery and medical treatment, we've already looked at that chart of statistics for how likely dogs are to recover with these two treatments. So we've already compared those. Now let's look at the other factors that come into making the choice. So to start with, surgery is extremely expensive, sort of alarmingly expensive actually in this time. It's very common for owners to have to pay out at least £6,000 for a miniature Dachshund to have an MRI scan, surgery, decompressive surgery, and a few days in hospital afterwards for standard care. And the cost can be much higher than that. It's often as much as £10,000 or even more than that. And this condition can be recurrent. So sometimes people are still paying off the bill for the first surgery, and they have to go in for another one a year or so later. It's a difficult situation, and do be really honest with owners about the cost of this up front. It's not even always covered by insurance, so it's important that they do check their insurance policy before going ahead. Of course, surgery involves a referral, it's specialised, and an anaesthesia is needed, of course. And some dogs will come home walking, but many come home initially not walking, and they need quite a bit of specialised care at home. So let your owners know that. So that home aftercare, it's really similar, much the same as the medical treatment. So medical treatment we'll sort of look at a bit more shortly. There's your analgesic, supportive care, and so on. Of course, it's much lower cost than surgery, vastly lower cost. The cost is rather unpredictable. It depends on how much support that dog ends up needing. They may need to come back and forth to see you on an outpatient basis, and some do need actually admitting briefly at some point. And of course, there's home care involved with this as well. I've also got this sign, PTS. So euthanasia, yes, it has to be an option. However, don't jump into euthanizing these dogs. Don't push owners into having these done, into having this done. Many of these dogs do recover, and they can surprise us. So don't jump to that as something to recommend. But in a few cases, you will actually need to suggest it. It really depends. You'll need to gauge the situation, see how the dog's owner responds as you start to explain to them about the options of surgery or medical treatment. And, you know, some will just be completely aghast and say neither is possible. So you may need to offer euthanasia at the first consultation. But in many cases, that's actually not appropriate at the first consultation at all. If so, I would somehow just allude to it even briefly. So what I often say is something like, even if we're sort of going for surgery or whatever's happening, if the owner's keen to pursue treatment, I often say something like, just bear in mind, this is a serious condition and it's quite an unpredictable condition. Sometimes dogs do get worse with this, and occasionally they reach a point where they need to be put to sleep. So sometimes I just sort of drop that into the conversation just briefly, and that just allows the owner, it sort of opens the conversation up so that if the owner does actually want to discuss that with you at that stage, it allows them to do so. So if the dog is going for surgery, should they go straight away as an emergency? Well, yes, once the decision to operate has been made, do refer the dog as soon as possible. However, this has changed actually. Spinal surgery is not as urgent as we once thought. Now, we used to think that these dogs, especially if they were very severely affected, had to be rushed straight in for surgery, definitely the same day. Otherwise, they had very poor chances of recovery. Now, that advice was actually based on limited data, based on quite a small number of dogs. And since then, there have been more studies done, more research, and now the conclusion is, so from this statement, the ACVIM consensus statement from this year, and they've said the current literature does not support the use of a specific timeline for urgent surgical decompression. So what that means is that if a dog with a certain clinical grade of disc extrusion is operated 2 hours after they've collapsed, they have the same chance of recovery as a dog of that same clinical grade of disc extrusion that's operated 2 days after their collapse. What that actually means for you in practice is that, and by the way, I wouldn't encourage you to wait 2 days, but what that actually means for you in practice is that you don't need to actually push owners to drive immediately to a referral centre. I have heard people say to me, I have heard clients say to me in several occasions, sort of, I feel like I was pushed into having surgery done immediately. I was sort of told I must have surgery or have the dog put to sleep. Those are the only options. Now we don't have this extreme urgency. It means clients do have the chance to just check their insurance is going to cover the cost, or check they have the funds necessary, even if it's just a matter of them thinking about it for a few hours. And many of them will want to go straight away for surgery, but it just means you don't have to really push them to sort of insist on it straight away. The other thing we now know is that this is quite surprising. Dogs can recover. So if they've lost deep pain sensation, they are reported to recover even if they have surgery a whole week after losing deep pain sensation. So we have studies demonstrating that. And this really is very different to what we used to believe. And what that means, the other sort of practical point from here is that if somebody brings in a dog to you and says, my dog collapsed last Friday and he's been like that, he's been like this since then. Now, you still can actually offer them the option of going for surgery. Just because it's several days since they went off their legs, it doesn't mean that's out of the question. My dog can't walk. Is non-surgical treatment an option? Well, the short answer is yes, it is. So again, from this ACVIM consensus statement, when dogs cannot be treated surgically, a medical treatment attempt is reasonable for all grades of injury severity, unless there is clinical evidence of progressive myelomalacia. So pragmatic approach may be, just considering the data that I showed you on the screen before, in many cases we feel, well, if the dog is unable to walk, perhaps they may have a better chance of recovery if they have an operation. However, if the owner cannot afford an operation, or if surgery is out of the question for another reason, perhaps the dog has a concurrent health condition, won't manage the anaesthetic, it is actually reasonable to try recovery with medical management instead. And of course, we have this new data coming out, which is starting to look as if the non-surgical option may have better recovery results than we previously expected. Disc extrusion on a tight budget is always a challenge. The first thing to say is do consider non-surgical treatment. Give the owner every option. Mention surgery as well. So you don't assume they don't have the money. But yes, be really open to the idea of non-surgical treatment and really support them with that. The second practical point is they can loan home equipment if needed, if possible. So they'll be needing a crate or a pen, a sling, and some other equipment as well. In the UK, we are lucky to have a charity that supports Dachshund owners. So if you're based in the UK, you can contact this. You can ask your Dachshund owners to contact this charity. It's called Dedicated to Dachshunds. They provide some basic advice, but they particularly they loan out home equipment such as pens, which is a really practical support for in this situation. Avoid unnecessary extras in your treatment. Of course, you will need to have owners pay out for some things. So these dogs are going to need good analgesics, and they may need some support with their bladder care. They may have urinary retention, and these dogs you may need to reassess them, check their bladder, express it, show the owners how to do that, perhaps even catheterize the dog. And you'll need to do your reassessments, but avoid prescribing anything that's not evidence-based to help to help dogs with the disc extrusion. So, for example, don't prescribe laser and don't prescribe nutraceuticals for these. Do give good, clear advice, though. It's so helpful. It prevents future problems. Advice such as keeping them clean, keeping their bladder expressed if needed, having a decent diet, that sort of thing. And this is another useful bit of information for those dog owners who cannot afford surgery. So this study I've already mentioned, it's still running at Cambridge University, and they'll be enrolling more cases up until the end of the year approximately. Now, they're they'll be happy to take dogs up to 15 kilos who are showing signs of thoracolumbar disc extrusion and who cannot walk. So hind legs affected, front legs unaffected, and typical signs I've shown you already in this presentation. It's important that that the owner cannot afford the cost of surgery, because that's one of the prerequisites of being enrolled in this study. But there will be a cost of £525 for which they'll get a heavily subsidised MRI, and they'll have the support of a neurologist during their medical care during the first 12 weeks of recovery. As I've mentioned, their results so far have been excellent, and dog owners involved in that have been very pleased. So you might want to scribble down their details. Let's have a think about what to do if the signs are very mild, very uncertain. Perhaps the dog looks as if they may actually have a gut upset, or you're not sure whether they have a disc extrusion. And for these, do assess them, as I've already mentioned. Treat them symptomatically, but do warn the owner that there could be a disc problem there. So, for example, if you've got a Dachshund, they look like they might have maybe pancreatitis, maybe a sore back, you're not sure which. So you could say something like, well, I suspect your dog has a gastrointestinal problem, or I suspect your dog has a stomach or pancreas problem. I'm going to start treating them for that, and you can provide the bland diet, whatever you're going to prescribe for that. But just bearing in mind they're a Dachshund, this could actually turn out to be the start of a back problem, because it's common in this breed. You might mention the term IVDD, and ask them to keep their dog very quiet, to keep them on the lead whenever they're outside, to avoid jumping, to avoid stairs, and to keep a bit of an eye on their dog. Do book a recheck, say for 2 to 3 days, or sooner if you're very concerned. But ask the owner to bring that appointment forward, or even to call you out of hours if they're worried about their dog, particularly if the dog is a bit wobbly on their feet or if they're walking strangely. Should we arrange an MRI or CT to check what's happening? Well, in general, no, because if you've got a mildly affected dog, a dog who can still walk, even if on MRI or CT a disc extrusion is found, many neurologists these days would actually be rather reluctant to operate on them, because, as I've said, we have to balance out the possibility of complications of surgery and the benefit. And in fact, these dogs have a very good chance of recovery without surgery. And MRI doesn't give us as much information as we might hope. In fact, the degree of spinal cord compression doesn't predict clinical outcome. It doesn't tell us whether or not the dog needs surgery. However, of course, if the dog is going for surgery, if you've made a decision with the dog's owner, that dog's going for surgery, they definitely will need advanced imaging beforehand. And that's generally done at the referral clinic on the same day as the surgery. And you'd also consider referring them for further imaging if there are atypical neurological signs, something else going on, maybe they've got a head tilt, something else going on at the same time, or if they have pain that persists despite a good painkiller regime. So what if my dog gets worse? My top tip is always have a plan B. Not just my mention of wheels, that could be your plan C or D, but always have a plan B. Let owners know some dogs do get worse, and it's just the nature of the condition. Diagnostic tests won't predict this. Not even an MRI scan can. So definitely arrange follow-up. Let the owner know how to reach you out of hours. And I recommend that you choose a cut-off point. together with the owner, choose a cut-off point for further action. So particularly if the owner has said, well, I'll be really keen I'll be really keen to have my dog referred for surgery, if that becomes necessary. So in that case, you might agree together that if the dog is getting worse at all, they should call you, or they should bring the dog in for an appointment, whichever you decide on. Or you might together have a cut-off point of you'll wait until the dog can't stand, or even if the dog can't walk, they'll come back. But I do recommend just to have this little agreement with the owner that they'll come back, or they'll call you, or they'll bring their appointment forward if such and such happens. And the plan B, so it might be that you're going to just re-examine the dog and decide with the owner what to do next. Or you might already hatch a plan together in which, if the dog starts to get worse, you'll get on the phone to the referral clinic and you'll organise an emergency referral. That may be a very kind of streamlined way to do this. If someone says, I'm definitely not going to go for surgery, I would still have a plan B. I would still say your dog might get worse if they reach a certain point, perhaps if they become unable to walk, or unable to urinate, come back and see me. I'll adjust their non-surgical care programme. And with some owners, you will end up with this discussion in which they say, look, I'd want my dog put to sleep if they get worse. And at least, you could have them come back in and discuss that with you. So getting started with home recovery, and this refers to this is for both after surgery when the dog comes home, or if they don't go for surgery, if they're going home from your clinic that same day. Starter outpatient care is the same for both of these. So just in a nutshell, because we don't have time to go through it in detail, but just in a nutshell, analgesics, they often need two types of analgesic, typically a non-steroidal, just your non-steroidal of choice, and we often use gabapentin together with that. The dog will need to be confined, more about that in a minute. They'll need to be carefully restrained whenever they're outside their pen or crate, so they'll need a lead and a harness. Dogs that can't walk will need to be supported with a sling, and they may need bladder care as well. There's a lot of detail involved in caring for a dog at home, whether they come home after surgery or if they are just being managed medically. And many owners end up having to do a lot of tasks they've never done before. Even using the lead and harness correctly is new to many owners, but also using a sling. Exercises and massage are often prescribed after surgery, so it's helpful for owners to know how to do this. So we're lucky to have this book available now, which is a fabulous reference for owners. It's full of colour pictures, top tips, prompts on when to go back and see you, and so on. So this is highly recommended. It's available from Amazon with next day delivery. If your owners get this book, a great place for them to start, if their dog can't walk, is section 3, this sort of overview of advice for dogs that can't walk. And if they can walk, there's another part of the book that they can start at. So it's just all very handy. It just contains top tips, safety advice, and it directs them to the necessary parts of the book for more details on practical things to do at home to care for their dog. They may ask your advice on how to keep them safe at home. We used to just say crate rest. For many of these dogs, a pen is actually perfectly appropriate, a pen with an open top, so long as they're not going to try to escape from that. So this works for some, but not all Dachshunds and French Bulldogs. So a pen or a very large crate are both options. Watch out though, particularly with crates. So This dog here, this dog was actually in a travel crate just coming home from surgery, of course, but I put this slide in just to show how a crate, sometimes we see this kind of crate sold for Dachshunds, and it's not suitable as a recovery crate. It's just way too small. So this is the dog in a recovery crate needs enough space to eat, to drink, to turn around easily, and of course to sit up normally. Um, a setup like this is way, way, way too small. So more appropriate would be this sort of size for early recovery. So this is a dog up to about 3 weeks into recovery that have this kind of floor area. And this is actually a pen that's been set up with 4 panels. And then here, the same dog in the same pen now extended. So they're now using 6 panels. So that's one very practical way to do this. We often extend their pen at about 3 weeks into their recovery, but you could extend it sooner than that if you feel the dog's unlikely to deteriorate. By the way, if they've got a urinary catheter in place, this is very occasionally happens that they get sent home with one after surgery. If they have a catheter in place, I would keep that pen. If they have a sort of long-term one, I would keep that pen at this sort of smaller size until that catheter's been removed. Room rest can be an option for larger breeds such as this Basset here. It's not always straightforward. It can be quite challenging to prevent these dogs from jumping on the furniture or from slipping out of the room as someone comes in. So just reserve that for certain cases. If the dog can't walk, they must be supported with a sling. I also recommend, in fact, it's essential that you have a lead on the dog. So that's essential for safety. They can just surprise you and dash off, even if they can't actually walk. It's also important to use the lead to slow their front end so that their hind paws have a chance to step. And this will help them learn to stand and walk. Now, a couple of practical points about this. One is don't use a slip lead for these dogs, because that slip lead will tighten around their neck and will pretty much throttle them if they lose their balance. Instead of that, I recommend having harnesses. If you have these dogs as inpatients in your clinic at all, have some adjustable harnesses to hand and attach a lead with a clip to the top of that. That's really going to slow the dog down nicely around their centre of gravity. The other practical point is it's important, this sounds obvious, but it's important not to hold the dog up by their tail. It's an old-fashioned technique which unfortunately is still being used in some centres. It's completely inappropriate because the tail, it's an extension of the spine, and it's not designed to have any weight put through it, any force put through it. So definitely don't hold them by their tail. Instead, if you have these dogs in your practice at all as inpatients, get some slings in, get some leads, get a couple of adjustable harnesses. That's how to really help these dogs walk in a welfare-friendly way. I'll just play this video. Here's another dog with thoracolumbar disc extrusion. This is a grade 2 with some paraparesis here. Now, these dogs, when they're outside, they must be on a lead. And so this is a before and after video for the same day, just to show you how putting the dog on the lead and using a certain lead technique can really help them to step better and improve their gait. So the key things here are, do use a harness. It's going to slow that dog's front end so their hind paws can step better. Use a lead that is a fixed length lead, not an extendable one, and walk really slowly. And there are some more kind of fine-tuning tips for this technique, but we don't have time to talk through them all at the moment. They're all in that book I mentioned, the IVDD handbook. These dogs, they should come outside for an attempt to urinate and defecate regularly through the day. I generally have owners take these dogs out five times a day, maybe slightly more or slightly less. So it's typically first thing in the morning, last thing at night, at lunchtime, once in the middle of the morning and once in the middle of the afternoon, and no more than 5 minutes per trip outdoors. And the owner should carry their dog over any difficult ground, such as shingle. They should carry them over any slippery floors and carry them over any steps, even door steps if they're a small breed. Another useful thing for owners to do with these dogs is just to support them in a standing position, four square, on a non-slip surface, starting with a very short time each day. It may just be 10 seconds just 10 seconds of standing to start with, and build that up gradually. There's details about that and of other exercises in the IVDD handbook. Urinary issues, these can be a real challenge. A few just basic tips to help avoid them. Do advise owners, as I've already said, to get their dog outside for regular outdoor toilet breaks. There is a cerebral component to urinating normally, and some dogs actually need to smell where they've been before they will attempt to do this. They should stand still with their dog when the dog stops. Many of these dogs just simply find it difficult to posture to urinate. The dog in the picture here was actually a good couple of weeks after surgery trying to cock his leg, but even just trying to squat to urinate can be extremely difficult for these dogs. So stand still with them, use a sling if needed. They're prone to recurrent urinary tract infections. All dogs with disc extrusions are prone to these urinary tract infections. So they should have good access to drinking water. Remind owners of that. The water should be in their pen or crate close by them. That's going to help them stay hydrated. And you may need to advise them to express their bladder as well, depending on how severely they're affected. When will my dog recover? Key point today is that learning to walk is a gradual process. Don't expect it all to happen at once. Be patient. This chart is from Davison Brown's paper, and I've just included this. It just gives a nice illustration of the range of time taken to walk again after surgery. So these dogs all had deep pain sensation, but they couldn't walk at time 0, and then they had their surgery. Well, before the surgery, and then they had their surgery at time 0, and then this is their time to start walking again in days. So by the end of week 1, round about here, and many dogs will be discharged from hospital around this point, maybe a little sooner or later. So you can really see that many dogs are coming home actually unable to walk. There's a great range in how long it takes. So you need to be patient and expect gradual improvements. They tend not to just suddenly get up and walk normally, of course. Even when these dogs do walk, their first steps are likely to be very wobbly. They'll need to be kept slow on a lead and be careful. The first signs you'll be looking out for are going to be the dog starting to be able to hold a standing position, perhaps to step a little with the sling support. That's going to be a positive thing. And eventually not needing quite so much sling support, perhaps their muscles really twitching in an attempt to step unsupported. So watch for these signs as you see the dog back regularly, and just be supportive of these owners. It can take quite some time. A few of these dogs don't recover the ability to walk, and yes, there is this option of putting them in wheels. When they go into wheels, if they can't use their hind legs, then the hind legs will be sort of strapped up into stirrups at the back here. And they'll just kind of learn to walk with their front legs in this different way. And I really recommend only use wheels, only recommend wheels for those dogs that are not expected to walk again. Because if you use them for dogs that are still trying to learn to walk, then they're going to learn to move in this abnormal way, just using their front legs, and it will make them less likely to go on to walk normally. So before recommending wheels, really assess the dog carefully. Could they still recover? One thing to consider is, did the dog have deep pain sensation? So either at the start of their recovery, if they've been managed without surgery, or did they have deep pain sensation when they came round from surgery, if they've had surgery? And if they had lost that deep pain sensation, then that needs to come back before they're going to learn to walk in general. Some dogs do go on to do something called spinal walking, in which they sort of move in a rather wobbly way, even with no connection to the brain intact. However, if they're going to walk fairly normally, they need their deep pain sensation to come back first. And if that deep pain sensation is going to come back, it's almost certainly going to come back by the 4-week point. You could give them a little bit of leeway and say by 6 weeks, but it's unlikely that that deep pain sensation will come back after 4 weeks. So 4 weeks is a good time to recheck their deep pain sensation if it had been lost. And if they still have no deep pain sensation and they're making no progress, that's a time to suggest going into wheels. If they'd never lost their deep pain sensation, then watch for little signs of recovery. They should have, almost certainly, they'll have some chance of recovering the ability to walk. But see how they're doing. And if they're making no progress, you may need to consider wheels. But I usually leave that until about 3 months, as long as 3 months into recovery, before resorting to wheels. And before recommending wheels, it's really important that owners do follow some kind of basic care advice, so they give their dog a good chance of learning to walk. The dogs should be confined so they don't just learn to drag themselves around as a compensatory movement pattern. They should have brief toilet breaks with sling support, but they shouldn't be, don't increase the length of their toilet breaks, don't increase the length of their walks, otherwise they'll just learn to move about for long periods with the sling, a bit like learning to wheelbarrow walk, and that actually won't teach them to walk either. So keep the exercise sessions short. Only use non-slip footing, because slick floors such as tiles or wood are just going to encourage them to drag themselves about. Do some daily supported standing practice. There are some other exercises as well that may help. And if you're lucky enough to have a good physiotherapist or hydrotherapist based within good travel distance, then consider referring to them, because they can give more bespoke support. So just to summarise, give your dog owner options. Don't just assume they'll want to go for one type of treatment. Do also tell them that disc extrusion can be unpredictable, warn them about possible deterioration, and always have a plan B. And do give them clear advice on home care. Well, thank you for listening. So does anyone have any questions? So note of where to find me. And this is the book I was mentioning, which is full of tips. So I'm just going to stop sharing my screen, and then we can think about questions if there are any.
Marianne, thank you very much. I'm going to stop the recording now, and we'll take questions away from the recording. www.therehabvet.com if you want to find out more about Marianne, and her book is available to be ordered via a link on her homepage. I've also dropped some links into the chat in the course of the webinar. There's a link to Sam Khan's email address at Cambridge University for that conservative treatment program for paralysed dogs. And I also dropped a link in for the Kennel Club's intervertebral disc disease screening program, which is available to people who are breeding Dachshunds. That's a screening program for dogs between the ages of 24 and 48 months. So I'm going to stop the recording and then we'll see whether there are some questions. Marianne, thank you again.
Pleasure.